High blood glucose over a period of time can cause very serious long-term health problems. High blood glucose damages the large blood vessels, small blood vessels, and the nerves of your body. Large blood vessels carry blood to your heart, brain, legs, feet, arms, and hands. The exact connection between diabetes and large blood vessel disease is not yet fully understood. But we do know that it is related to high blood glucose, high cholesterol and/or triglycerides, and high blood pressure. These health problems contribute to the formation of plaque on the inside walls of the blood vessels. This process, known as atherosclerosis, reduces the amount of blood that can pass through the blood vessels. This can lead to heart attack, stroke, and poor circulation. A heart attack is caused by reduced blood flow to the heart muscle. Heart tissue supplied by that blood vessel wastes away or dies. In fact, people with diabetes are 2 to 4 times more likely to have heart disease than people without diabetes. Decreased blood flow to the brain results in a stroke. And the loss of circulation to the legs and feet can cause pain and make cuts and sores very slow to heal. High blood glucose levels can also damage small blood vessels and lead to eye disease and kidney failure. In the eyes, high blood glucose can cause the tiny blood vessels of the retina to leak or rupture, interfering with vision. This is called diabetic retinopathy. In the kidneys, damage to the blood vessels can cause a condition known as diabetic nephropathy, which can lead to kidney failure. High blood glucose can also damage the nerves. This damage may cause some nerve cells to lose their ability to transmit signals as they once did. This is called neuropathy. Neuropathy can cause pain, loss of sensation, and muscle weakness, usually in the hands, legs, and feet. Neuropathy can also affect the functioning of the heart, bladder, digestive system, and sexual organs. The long-term complications of neuropathy and poor circulation in combination with a skin breakdown, such as a cut or sore, often leads to amputation. For more information about foot care, go to Chapter 11, Maintaining Your Good Health.
Final part.
But there's good news. There's a lot you can do to prevent these problems. Studies such as the Diabetes Control and Complication Trial and the United Kingdom Prospective Diabetes Study showed that if you keep your blood glucose in your target range, your chances of developing complications can drop by 56% for kidney problems, 60% for nerve problems, and 76% for eye problems. So we know without a doubt that you can reduce your risk of long-term health problems by keeping your blood glucose level within your target range. This will also help reduce your A1C and move your blood glucose toward normal. Members of your diabetes care team are there to help, so take advantage of their support.
Diabetes is a serious disease that increases your risk of long-term health problems. By keeping your blood glucose in your target range, you may be able to avoid these complications. Have you experienced poor circulation, slow healing of cuts, muscle weakness, or sexual dysfunction? Have you made regular healthcare appointments to check for these problems as well as possible vision and foot care complications? Meet with your diabetes care team to talk about long-term health concerns you may have and learn some steps you can take to prevent them.
Many people who have diabetes also have heart disease. In fact, heart disease is the leading cause of death among people with diabetes.
That's awesome.
Cholesterol and triglycerides are fats that circulate in your blood. Your body needs both, but too much of either can increase your risk of developing heart disease. So you'll need to have your cholesterol levels checked regularly. However, all blood fats are not the same. HDL and LDL blood fats make up a large part of your total cholesterol number and should be checked along with your total cholesterol number. LDLs, or low-density lipoproteins, form the plaques that build up in your arteries. That's why they're also known as bad cholesterol. And HDLs, or high-density lipoproteins, are often called good cholesterol because they actually help remove LDLs from your blood. Triglycerides, another form of blood fat, can also increase plaque buildup. Your total blood cholesterol should be less than 200 milligrams per deciliter, with your LDL less than 100, and your HDL greater than 50 if you are female and greater than 40 if you are male. Your triglycerides should be under 150. Hypertension, or high blood pressure, is also common in people with diabetes and can increase your risk for heart, eye, and kidney disease. So it's important to monitor your blood pressure at each diabetes care team visit. Your blood pressure reading is a measure of how hard your heart has to work to pump blood through your body. If there's a buildup of plaque in your arteries, your heart has to work even harder to force blood through your vessels. The National Blood Pressure Education Program tells us that people with diabetes should keep their blood pressure under 130/80.
You've lost almost 5 pounds in a month.
Many people with diabetes, especially type 2 diabetes, are overweight. Losing weight, even 10 to 15 pounds, can improve your blood glucose, blood cholesterol, and blood pressure levels. Here are some tips to help you get started and stay motivated. Don't bother with so-called miracle diets and quick weight loss plans. Fad diets are geared toward taking weight off quickly rather than keeping it off by learning healthier eating habits. Inactivity is another risk factor. Try to increase your overall level of physical activity in day-to-day living. For example, take the stairs instead of the escalator, or go for a walk after dinner instead of sitting down for a night of TV. Generally, a healthy rate of weight loss is no more than 1/2 to 1 pound per week. Don't weigh yourself every day, because day-to-day changes in your weight may cause you to become disappointed and lose interest in achieving your overall goal.
I think losing the weight really helped. I think a lot of times I didn't feel well because I just didn't eat right.
I've lost about 4 inches in the belly. I've got a pair of pants in there that, well, in fact, these, if I loosen my belt and stand up, they'll fall off.
If you smoke and have diabetes, your risk of heart disease is very high because smoking and high blood glucose damages blood vessels, speeding plaque buildup. Quitting smoking can help you feel better and have more energy, and can reduce your risk of heart disease. If you feel like you need help quitting, your diabetes care team can suggest ways to help break the addiction. You may also need the support of your friends and family in this effort.
Having diabetes does not mean you will get heart disease, but it is a serious concern that you have to be aware of. Your risk of it increases if you are overweight, have high blood glucose, high blood cholesterol, high blood pressure, or smoke. The first step in helping to prevent heart disease is to determine your individual risk. If you smoke, have you talked to your diabetes care team about the best way to quit? Do you know what your cholesterol levels are? HDL, LDL, triglycerides? Do you know what your blood pressure is? If you're overweight, have you talked to your diabetes care team about setting realistic weight loss goals and a healthy way to achieve them? If you're not sure where you stand, Make an appointment with your diabetes care team to determine your risk, create a plan to reduce your risk, and decide how to check your progress.